Now the next thing that we will be studying is about the malnutrition, and malnutrition is so important topic that you will read this topic in your PSM also, and when you go to your final prof you will read this in your medicines also. Okay, so what is malnutrition? It is basically a condition in which there is insufficient calorie intake. Okay, or basically you can say the nutrients are not properly taken. What are the nutrients you have? In nutrients you will have protein, fats, vitamins, minerals. Yeah, right. Now, next you have the type. So you have, what are the nutrient types that it has? Either it can be undernutrient, either it can be undernutrition, or it can be overnutrition. Obviously, either there is extreme or either there is very low. We are not middlemen, right? Either we will study so much or either we will not study anything, right? So, what happens in the undernutrition? In the undernutrition, there is deficiency of nutrients. Okay, there is deficiency of nutrients, and in overnutrition there is excess. There is excess of nutrients. Okay, there is excess of nutrients, right? Now the next thing that I want you all to understand is about the types of malnutrition that you have. The types of malnutrition. Okay, in the types of malnutrition, first you have that we will be talking about undernutrition. In the undernutrition, you have protein energy malnutrition. What happens here is you have two types. What are the two types? Kwashiorkor and Marasmus. Kwashiorkor and Marasmus. Okay. Now, what are the deficiencies that you have? So, you have certain micronutrient deficiencies as well. What are the micronuclear deficiencies you have? You have first one is the iron deficiency, and iron deficiency is very much common in India, right? Second you have is the vitamin A deficiency. And what is the prophylaxis that we give for vitamin A? Tell me, what is the prophylaxis you give for vitamin A if a person is less than 9 months and if a person is more than 9 months, right? Then you have the iodine deficiency. And you know guys what? You will study all these programs in your PSM. Okay, so be ready with that. Then you have the vitamin D deficiency. Then you have the vitamin D deficiency. Okay, so these are all about the basically the deficiency portions that we have. Now, this was about the undernutrition. Next, we will be talking about the overnutrition. Wow, overnutrition, right? When we talk about overnutrition, what is the first thing that should come to your mind is a image of an obese person, right? So I'm not body shaming anyone, but that should be coming to your mind. First one is obesity, and then is the overconsumption. Overconsumption of what? Overconsumption of fats, sugars, or other micronutrients Okay, so this was all about the overnutrition and the malnutrition that you have. Now, what are the causes? What are the causes of what? Causes of malnutrition. So the first cause that you have is the inadequate intake of food. Obviously, if the person is not consuming the right amount of food, then he or she will end up into the malnutrition state. Second one is the poor dietary diversity. The poor dietary diversity. Now, what is meant by this is, like, if you compare a person from a rural place and if you compare a person from an urban place, you are able to see that people who are living in urban areas, they have a very, very good diet, right? Whereas the people who are living in the rural area, they have a very poor diet, right? So this is all about the poor dietary diversity. Third thing that you have is the increased nutrient loss. Now, what can be the reason? There can be either the person is having diarrhea, either the person is having an excess amount of vomiting. And tell me, what is the medicine that we give when a person is feeling nauseous or having excessive vomiting? That you have to tell me. And if you don't know, go back to your pharmacology lectures and read from there, right? Now, next that you have, the cause is the poverty and food insecurity. And food insecurity. I guess you know what is the term below poverty line. So the people who are below the poverty line, they are more prone to developing malnutrition. Okay. Next is the lack of education and awareness, obviously. Next is the loss of education and awareness. If a person is not aware that what diet he or she should take, he or she should take chips, noodles, or whatever the thing or not, right? They should know what are good food for them and what are bad food for them. So they will be taking them in adequate amount, right? Next that you have is if a person is having what? Recurrent infection. If a person is having recurrent infection and chronic disease. See, if a person is having a chronic disease, the disease which is from a duration of more than 6 weeks. So if a person is having a chronic disease, then what happens is there is a lot of body fluid that is lost from his or her body, as a result of which the body is not able to take that food into proper consideration, right? The body is not able to absorb that food basically properly. Now, the next thing that I want you to remember is about the other causes that you have is the, maybe there are environmental factors. What are the environmental factors? Maybe there are droughts that are happening over there, or maybe the country is so poor that they are not able to afford that much, right? Maybe the country's GDP is not that good. Next that we will be studying is about the protein energy malnutrition. Is the protein energy malnutrition. And there the first thing that we will be studying is about the Kwashiorkor, is about the Kwashiorkor. So in the Kwashiorkor, what you all need to study is that in Kwashiorkor there is protein deficiency, there is protein deficiency with adequate calorie. See, this means there is availability of the nutrients that are there, but the body is not able to absorb that nutrient properly, right? Next, what is the common age of presentation? Mainly the person is 1 to 3 years is the common age of presentation. And if I talk about the pathogenesis, then you have first the low proteins are there, as a result of which what will happen? There will be hypoalbuminemia, as a result of which the person will develop edema. Okay, and you have to tell me what are the grades of edema that are there, what are the grades of pitting edema that you are able to see. And if you don't know, just go to your medicine postings regularly, right? Next that you have is the clinical features. What are the clinical features you have? First one is edema that is there, usually the pitting edema. Next you have is the enlarged fatty liver. And there you are able to see the dermatosis. What is dermatosis? Dermatosis is basically flanky paint appearance. It is basically a flanky paint appearance, right? Next, you will have the growth retardation. What are the investigations? In the investigations now, what you are able to see in the investigations, you are able to see when you will do the investigations of all the LFT, KFT and the CBC that you have to do, you will be seeing that the serum albumin level will be low. Okay, and the liver functions are abnormal. So these are basically the things that you will be seeing in the investigation portion. Now the treatment that we will do here, the treatment per se is what? There is gradual nutritional rehabilitation. See, similarly we do for nicotine rehabilitation. Similarly, we should also do for the mobile phone rehabilitations. Sooner or later, this thing also will start, because the addiction of mobile phone is increasing day by day. And you have a phobia by the name of nomophobia, right? So what happens in that phobia now? I was reading, if there is a battery of 2% also that is there in a person's phone, he or she starts panicking. So this is a new phobia that has come into the market, and you should know this, right? Because I remember this because it was asked in my final exam of medicine, I guess, and it was a 6-mark question, and I was not able to recall what is nomophobia because we have never read about this phobia, right? So it is a new phobia that has come into the market. Anyway, the next thing that I want you all to understand is about the treatment. See, if there is any infection now, if there is infection and dehydration, there is any infection or dehydration that is there, then you have to treat it accordingly. What you will give for dehydration? Either you will give, what you will give? Ringer lactate, normal saline, or what? Or both? That you need to tell me. Next that you have is about the marasmus. Okay, let me just highlight it. What happens here is, here there is calorie deficient. There is calorie deficiency, as a result of which it also presents with protein deficiency. Okay, what is the presenting age? It is less than 1 year is the presenting age, and in the Kwashiorkor we have seen it is in between 1 to 3 years, right? What are the clinical features that you have? Clinical features. I don't know what has happened to my writing. First thing that you have, there is no edema present. Then there is thin and dry skin that is there. Then there is irritability and constant hunger. Maybe some of you also having a constant hunger. And you know what it is called? It is called as binge eating disorder. You will read this in your psychiatry. You know, binge eating disorder is one of the most common disorder which is there in India. What happens in this disorder is basically after an hour of the person has a severe urge to eat again and again and again, right? Any kind of chip, any kind of carbonated drinks, right? So it's a very common disorder. And actually, I think I also have that. Then you have is the poor immunity. In investigations, what you are able to see? We will study about this Kwashiorkor and Marasmus in PSM also. And that will be very, very interesting because you will be able to see some instruments also over there. Investigations, you are able to see that the weight for height, the weight for height is less than -3 standard deviation. What is the treatment that you will do? The treatment that we will do is what? So the treatment, in the treatment you have the rehydration and slow refeeding. You will study about the refeeding syndrome in your surgery lectures. Second is the high calorie. Third is the infection control. Third is the infection control. So these are basically the thing that you need to see. What we have read in the Kwashiorkor, there were calories sufficient, but the body is not able to absorb that. Here, there is calorie deficiency. Next that I want you all to understand is about the certain deficiencies. Okay. Next thing that we will be studying is about the prevention strategies, because it is very well said that prevention is better than cure, right? So the prevention strategies that you need to follow, first one is the at individual level. What you have is the exclusive breastfeeding. The exclusive breastfeeding for 6 months, right? Next is a balanced diet. And guys, we have studied this in our 5th standard also, right? I remember in the textbook there was a diagram. Okay, I'll just draw the diagram. That diagram was there, and there you have this rice, then you have the chapatis, the dal, and all the things that are there, and it represents that a person should have a balanced diet, should consume a balanced diet, right? So you should also take a balanced diet. Next you have is the regular deworming and vaccination. Regular deworming and vaccination. Next that you have, you should always maintain a hygiene and sanitation. Hygiene and sanitation. You should always take care of that. Next, this was at the individual level. At the community level, what you have? So at the community level, you have the nutritional education. You have certain workers like the Anganwadi workers, like the ANMs, right? So the government appoints them and they are there to provide you that education, right? Not to you, but to the person who is below a poverty line. You also have BPL cards for them. Second, there is a school meal plan. School meal plan. And we will learn about this in your PSM. You have a midday meal program which is run by the government in the government schools. Then you have the maternal health services, because it is very well said, if the mother is good and if the health of mother is very good, then the health of child will automatically be good. Okay, so this was all about the malnutrition that we have.